So this is a subtalar joint lateral glide meant to improve ankle eversion range of motion at that subtalar joint specifically. Now, to stabilize, typically I would lay my forearm on the lower extremity to make sure the lower extremity doesn't move. However, for mobility's sake, I am placing my knee on a towel on top of his lower extremity. Does that bother you?
No.
Okay, great. So from there, I'm going to stabilize just distal to the medial malleolus, okay? And then I'm going to place my mobilizing hand on the medial aspect of the calcaneus, gripping firmly, and from there I'm going to apply a downward, which would create a lateral glide because my patient is inside lying. Downward force to glide the calcaneus on the talus. To improve range of motion, we would use a grade 3 to 4. I'm using a grade 3, so a larger amplitude through to the end range of motion, trying to improve his end range of motion. A grade 4 would be pressure to the end range and then oscillations at the end range. This could also be used for pain modulation, which would be a grade 1 or 2, so not at the end range of motion. So this is a video of anterior posterior and supine decreased dorsiflexion range of motion, and can also be combined with eversion to improve pronation range of motion. Patient's going to be in supine. I'm going to be stabilizing at the distal lower extremity. Okay, my mobilization hand is going to be just distal to both malleoli, primarily applying pressure to the anteromedial portion. Lock my elbow out, and from there I'm going to apply a downward talus to create a mobilization from anterior to posterior. And manipulate the range of motion into dorsiflexion by providing dorsiflexion pressure through my body against his forefoot. And I'm just going to provide oscillations outward, trying to improve that dorsiflexion range of motion. Typically here, because we're improving range of motion, or that's at least the goal, probably grade 3, larger amplification through to the end range of motion would be my choice of grade for mobilization.